Partnered by Times Influence.
Hello and welcome to a very special show on the channel. Asian Cancer Institute presents Can Win, Fight Cancer with Hope. Now, cancer, a word that usually just numbs your senses. We are hearing that word too often nowadays. But to find out more about what cancer is, what are some of the symptoms, what can we do to fight it, to prevent it, and to lead a fulfilling life, I am joined by a team of experts from the Asian Cancer Institute. Allow me to introduce them to you. First up, we have Dr. Jagdish Kulkarni. He's the Director, Urogenital, Gynec and Robotic Surgery. Welcome to the show, Doctor. We have Dr. Deepak Parekh. He's the Chief of Head and Neck and Laser Services. Welcome to the show, Doctor. We have Dr. Ramakant Deshpande, also known as Dr. Raman Deshpande. He's the Director, Thoracic and Breast Cancer Services. And finally, we have Dr. Sanjay Sharma. He's the Co-Director, Thoracic, Breast and Gastrointestinal Cancer Services. Welcome, doctors, to the panel. Dr. Sharma, I'll start with you first. Cancer, what does this mean? Because it's not just a 6-letter word. There is a lot behind it. So can you take me through some of the common cancers that are afflicting the Indians today?
In a nutshell, one thing I must say that cancer is not a one disease. It's a group of diseases conglomerate into one group. The premise is that here the body cells, which makes body a different part, what called as unit, that get disrupted by internal mechanism, external sources, and some kind of immune depression systems in the body, and that the cell starts growing too much, and if the cell has already grown, they don't die, so they accumulate at one place, and that's what the cancer is. Okay. Yeah, broadly. And the commonest cancers are in India basically are oral cancers, breast cancer, which are very high, lung cancer, and of course upper and the lower GI.
See, the body consists of over trillions of cells, and it functions through a system. There are multiple systems. There is a digestive system, there is a urogenital system, there is a respiratory system. Each system has various organs, and when something goes wrong with any of those organs through the causation of a cancer, then that is a location for that particular cancer.
Dr. Parekh, if you could share first you and then I'll come to Dr. Kulkarni also, just some statistics. How has this disease spread about in India? What are some of the numbers?
Well, currently it's estimated that we are anywhere between 10 to 12 lakh new cancers every year. Okay. Added to that, well, there's a positive side that we have been able to cure quite a few of them, and they're living long enough to sometimes even develop a second cancer. Okay. So that is adding to the pool of cancers that develop every year. What has mainly contributed, in my opinion, is the lifestyles that have radically changed. Right. Second, the aging of the population has increased. I mean, 30 years or 40 years ago, a person living up to 50, 55 was considered a normal life. Today, we are looking at 70s and 80s. Right. So it's a part of a process of aging as well, which is adding, and you're seeing more number of cancers. In the lifestyles, I think one of the most common and most predominant factors in India is the habit of tobacco in any form. Another issue which has, on the positive side with awareness, has changed in certain cancers, which probably Dr. Kulkarni would talk about, is like a cervical cancer with hygiene issues being addressed to more radically and more appropriately.
The basic good news is that the cancers which were seen in 60s and 70s has changed. For instance, cancer cervix, which was 21 per 100,000, has come down to 9, which is a great benefit which we have achieved in the last 40 years or so. That's because mainly awareness and several things and personal hygiene. But other thing is the mortality from the cancer whenever they develop hasn't changed, and that's a really cause for us to concern, and we have to improve upon that. And that was possible with all kinds of awareness and of course improved technology in diagnosis and early detection, as rightly said.
Problem in India, we are not very conscious about change of our systems, in the sense that we underplay our symptoms. We don't recollect our symptoms, we attribute causes to it. Moment we start realizing that 15, 20 days, 1 month, 2 months we are having the same thing, we go to a doctor and better check.
Right. Dr. Deshpande, I want to play a bit of a devil's advocate with you. Now, unfortunately, sometimes it happens that cancer affects somebody of a young age also. People might feel that cancer just randomly comes out and affects someone. How do you guide such patients? Because I'm sure they must be coming to you.
No age is exempt from any disease, be it cancer as well as cardiothoracic. For example, newborn children are as affected by a cardiothoracic problem as sometimes by cancer. So there could be a genetic predisposition for this, very, very rare kind of a thing, but it can occur. Particularly, the eye tumors, what we call as a retinoblastoma, can be found even in a newborn child. And this is something which has got a genetic predisposition in that. Now, pediatric tumors actually appear to be very aggressive, they grow very fast, but they respond also beautifully. The incidence of cures are the highest in pediatric tumors. We must understand one thing, as average age is going to be, the longevity is going to get increased, as pollution will continue, as the dietary habits are going to continue, cancer is going to be part of our life. This is what we must understand. We are not really worried about diabetes because it can be controlled. We are not worried about hypertension, it can be controlled. But today the strategy for all the cancer specialists is try to cure it as far as possible, get rid of it once for all so that you don't really need to further treat it. But if you can't do that, then try to convert it into a chronic kind of a disease like diabetes by either giving medicines or by doing genetic manipulations or so on and so forth. Right. So if you can't cure it, make it into a chronic kind of a disease.
So you can lead a continued, a fulfilling life after you have been afflicted by cancer. On that note, we've met with some survivors of cancer. So let's hear from a few of them about how they are continuing to lead their life after having been diagnosed with this disease.
Once you're diagnosed as having cancer, the whole world comes down on you. You think that that's the end of the road. But then my doctor friend said, it is not so. You go and consult Dr. Kulkarni, who will then take care of you. It's a question of belief. And after coming to Bombay, I met him and he conducted my surgery and all that. And now I'm perfectly all right.
2008 में मेरा कार्सिनोमा डायग्नोस हुआ था. पहले मुझे सॉलोइंग में प्रॉब्लम होती थी, लेकिन फिर जब मेरी एंडोस्कोपी वगैरह कराई तो उसमें कार्सिनोमा डिटेक्ट हुआ था. तो पहले हमने यहाँ दिल्ली में कराया, सब जगह जांच वगैरह कराई, लेकिन यहाँ पे डॉक्टरों ने हमें जवाब दे दिया था बिल्कुल कि ये गॉन केस है. तो हमने तुरंत बॉम्बे डॉक्टर संजय शर्मा से अप्रोच किया और उन्होंने बोला ऑपरेटेबल एंड क्योरेबल. कैंसर का बहुत अच्छा इलाज है अगर आप सही डॉक्टर के पास और सही समय पहुँच जाते हो, और अगर आप खुद स्ट्रगल करते हो तो आपने ज़रूर हराना है कैंसर को. कैंसर आपसे नहीं जीत सकता, आप ही जीतोगे उससे.
যখন 2002 সাল তখন আমার মনে হলো যে আমার এখানে একটু ব্যথা হলো, তারপরে আমি দেখলাম যে আমার একটা কিছু করতে হবে. তারপরে আমি ডক্টরকে পাস গেলাম, সেখানে ডক্টর আমাকে করলো, অপারেশন করলো. তারপর বায়োপসি করার পরে ধরা পড়লো আমার ক্যান্সার, ব্রেস্ট ক্যান্সার. তারপর সঙ্গে সঙ্গে আমরা বোম্বেতে এসে গেলাম, হ্যাঁ, এশিয়ান ক্যান্সার ইনস্টিটিউট, ডক্টর সঞ্জয় শর্মা, ওনার ট্রিটমেন্টেই আমি এখন আছি. যখন আমার চিকিৎসা আরম্ভ হলো, ডক্টর সঞ্জয় শর্মা এত ভালো, আমাকে ভীষণ কেয়ার করেন. হি ইজ এ বেস্ট ডক্টর.
How do you balance between a patient who is knowledgeable versus over knowledgeable?
Well, cancer, as you rightly mentioned at the beginning, the word cancer itself brings a fear, so they tend to Google. The problem is not only just the disease itself, but they also start Googling the doctor, the hospital, etc. They just go through the whole thing. Well, I can just sum it up in one word. Unfortunately, and thank God for it, Google does not treat them. So we are still a little far from that. Maybe artificial intelligence would come in and would help in that as well. But I think what one has to understand when you embark on a career into cancer as a doctor or a physician taking a specialization into this kind of a field, you need to realize that take yourself onto the other side of the table and when the patient comes, and you have to have empathy with that patient. it's more the myths and the misconceptions that they get and they hear from a lot of people around. And I put it simply, of course, things have changed today where people tend to talk openly about cancer. But 20, 30 years ago, which I totally used to be surprised about, they would hide the fact that they have got a cancer, but they would openly talk about tuberculosis, for example. A lot of awareness programs by various doctors, hospitals, organizations, NGOs has played a big role, with media chipping in, because we very often as doctors we keep seeing all the advertisements coming in. I think the government even proactively has started warning people. It's a slow process, but I think every drop in the ocean is going to count in making it.
That's for sure.
But unfortunately, there is one myth which as all of doctors yet to be comfortable with, that when we ask majority of people to do a biopsy, they are scared. Oh, it will spread. So, I think with you, we should inform them that the biopsy is a very necessary element in beginning of treatment of cancer, so that we can get small little biopsy. We don't open nowadays, we put a small little needle, 2 cut on the local anesthesia, the OPD procedure, and we get so many information regarding the histology, the molecular biology and different kinds of gamete that we can treat it now. So that is very important thing.
You're watching Asian Cancer Institute presents Can Win Fight Cancer with Hope. It's time for a very short break. Don't go anywhere. We'll be right back. Welcome back to Asian Cancer Institute presents Can Win Fight Cancer with Hope, where I'm in conversation with the esteemed set of doctor panel, and we're talking about cancer and the way forward in India. What are some other myths or misconceptions that doctors come to?
One of the things which I'm noticing of late is, a lot of the parents are in India and the children abroad. And every time I get a call, I'm calling from Los Angeles and I have access to many institutes in USA. Can I show this? And he has to be convinced that the treatment his parent getting is equal to what he would have got in Los Angeles. So that's another thing which is observation.
Dr. Sharma, I'd like to start with you and then come around the panel. Just you all 4 doctors are experts in a certain field of a certain branch of oncology. Just couple of thoughts on the field that you're a specialist in. What is the things that a viewer should be aware of? What are some of the simple steps that they can take to prevent, or if they're diagnosed, how they can cure themselves? So just your guidance to our viewers.
I would talk to you about the most common cancer in the women population is the breast cancer, which unfortunately is because of whatever reasons, lifestyle, one of the majors, has increased exponentially, especially in urban areas. The incidence previously was just about less than 20, earlier is almost about touching 30, 35 per 100,000. So the rural is same. It's basically because of lifestyle. Children, ladies now, they don't want to get married early. They're now getting married late. They have no issues till late. They don't breast their babies because they're rushing to the offices. And there is unfortunately increased incidence of smoking in at least urban areas among the women population, drinking, hookah parlors. And there are many other reasons why this breast cancer is very, very common. So the best bet is for them is to avoid all these things, which are common cause of breast cancer. But otherwise, the best bet is to only do a small little self-breast examination. Yeah, and especially as Dr. Parikh mentioned, if you have a family history, you can go to a doctor more frequently and have yourself checked that, okay, my mother had that, my grandmother had that. In that case, we can do some little blood tests and find out if you are BRCA positive, or is a new gene which is now proved to be a familial cancer gene in breast cancer, BRCA1, BRCA2. You can be, identified as high risk group, and then more frequent checkups are required.
Dr. Deshpande, just your thoughts.
See, I treat a lot of esophageal cancers and lung cancers in my field. Now, esophageal cancer is basically, esophagus is a tube which conducts food from the mouth to the stomach. It's just a passage essentially. So anything which causes an obstruction to it with a tumor will manifest itself as a difficulty in swallowing. Now this also can come up with, if you just swallow a boiling a cup of tea or something like that, you will also have a little bit of a difficulty, but that will not last for more than 7 or 8 days, 10 days. There are people who will have difficulties for 3 months, 6 months, their appetite will go down, their weights go down, they still don't go in for a checkup. So a simple kind of a checkup with a doctor in the form of a barium swallow or an endoscopy will establish a diagnosis. And unfortunately, because this is an internal kind of a disease, if you neglect it, it can spread very fast. And from stage 1, where you have a cure rate of almost 90%, to stage 3, the cure rate can go down to 30%. So this is the kind of a damage that one person can do to himself or herself. Similarly, lung cancer, which is commonly associated with smoking, tobacco, atmospheric pollution, ionizing radiation, etc., can cause cough, loss of appetite, and sometimes bringing out blood. And all that is really required is a simple plain chest X-ray, and that will give a diagnosis in 90% of the patient. I would say that after the age of 40, everybody should have a routine, comprehensive kind of a health checkup, which by and large will give us a diagnosis in most of these patients.
Dr. Parekh, your thoughts?
Well, my specialty is the head and neck cancers, and unlike my colleagues, unfortunately, my signatures roam all over the world because it's something that cannot be hidden. So the first question that normally they come up with is when I tell them that they have a cancer in one of those regions, be it the tongue or the mouth or the jawbone, oh, how will I be deformed? What will be the impact? The question changes from a cancer to rather the effects of the treatment. So again, as my colleagues have mentioned, if they come in early enough, today we have certain techniques like the laser surgery, the robotic surgery, where these surgeries can be done from within the mouth, without any scars, without opening anything. And if they're picked up early, the entire cure rate is practically the same as Dr. Deshpande mentioned in the various stages.
Great. Dr. Kulkarni.
Well, I deal with male and female genitourinary cancers, and there has been a lot of things happening in the last 3 decades, and technology has made a tremendous impact on that. Now, coming to a point that most of the times in males, they develop some kind of a blood in the urine. They are thought to be the stone disease and being carried on for some time. I think that's where the awareness comes up, and both from physician side as well as the patient side, that any blood in the urine which is painless cannot be only because of the stone. Having said that, even if you have a kidney cancer or for that matter bladder cancer, today the technology is so good that you can be back to what you are. And actually there is no disfigurement possible. And with robotic technology, the prostate cancer, patients are home on the 2nd or 3rd day. Now, as far as the females are concerned, of course, the cancer cervix, as I said, there has been a good news, there has been a tremendous drop because of our hygiene and development of toilet program which is going on. I think that will have a great benefit. Here also, even if you have a very early cervical cancer, it can be operated with a robotic surgery and patients are home on 3rd day. Lastly, and most important is, there are some questions which come up. Can they produce, if they develop cancer, develop before the age of 40, can they produce the children? Yes, certainly it can be possible that they will have a healthy children as well. So not only you can have a rehabilitation completely in terms of life, but also quality of life.
Dr. Deshpande, the Asian Cancer Institute. Give me a little background about the institute.
Right from beginning, we started the Asian Cancer Institute. Earlier it was known as Asian Institute of Oncology in 2002. For last about 16 years, we have laid down our principles on about 2 or 3 things. One is patient first. This is very, very important. You know, we have focused all our efforts onto patients, and starting from the preventive to the treatment part of it, to the best rehabilitation part of it, and to help socially. And you know, even those patients who are kind of financially challenged, they should not actually have a lack of facilities because they have no access to finance. We have ensured that that is how it works. So all these points we have actually taken care of, you know. So we have taken care of the patient, we have focused on the organization, we have tried to keep the costs absolutely low. Our motto has been excellence in cancer care at affordable cost. And we have been very patient. We have not gone gung-ho in marketing kind of our services. It's been word of mouth for last whatever several decades now, that we have a very large population of patients, each one which talks to the other one. So this has actually helped us, and it has brought a lot of satisfaction in our mind. Right. So this is what is important. Now this is where the institution comes into the picture. But we have also gone to the last mile. For example, there is a very large part of our country which doesn't have an access to major healthcare kind of a thing. So you actually reach out in the form of training the local health officers from the point of, say, various district officers. You bring them in, train them into how to diagnose cancer, at least the basics of it, and then coordinate with the local state governments to form daycare cancer centers at each location, and we have got district cancer centers which have been helped, and this is at no cost to those people. This is not a revenue generation. We are giving back to the society.
Just about out of time, but I'll start with Dr. Kulkarni and then I'll come round to the other doctors. Just final thoughts on cancer. Just well, our show Can Win, Fight Cancer with Hope. Just your closing.
The only thing is, don't worry about the cancer. Live with it and live very well. Don't worry about that.
Yeah, sure, Dr. Park.
Adding to that, I would say that come early, get yourselves checked up in time, and take the preventive measures which are very well documented in any Google, if I can add it. Just Google it and you'll get all the answers, what you should take and what you should avoid.
Fantastic, Dr. Deshpande.
Live well and be ready for the worst, because having a mediclaim and insurance specifically for either for cancer or for any illness is an absolutely mandatory thing. It's as mandatory as having a umbrella while going out during a rainy season, and absolutely essential in today's day and time. Remember, the largest cause of personal bankruptcy abroad is basically an unexpected illness. So I think insurance is an absolutely essential thing.
Very true, very true.
I would join with my colleagues, obviously live healthy life, avoid those things which are known carcinogens, and modify your lifestyle. Now weight is also one of the major factors of some cancers. With awareness coming in urban areas that there should be a weight reduction program, I think you should eat right, do exercises and live healthy. So cancer incidence will come down, and even if you have, you can win the cancer, as Asian Cancer Institute's motto is, definitely we can.
Fantastic. Thank you so much, doctors, for that interesting conversation, all the points that you have brought up. Thank you so much for watching. You were watching Asian Cancer Institute presents Can Win, Fight Cancer with Hope. And yes, it is true, we can fight cancer with hope with all the information that we've shared here. Just be sure that A, lead a good life, lead a healthy life. If there is any concern, please do go visit a doctor. Let's not procrastinate about it. And together, I'm sure we are stronger now and we can fight this and live a healthy life before, and unfortunately, even if we are diagnosed with it, we can lead a fulfilling, healthy life after that. Thank you so much for watching.